So good afternoon and welcome everyone. My name is Ha Trong. I use she, her pronouns, and I'm a PhD student within the Department of Epidemiology. So welcome to today's seminar on building advisory boards to include participant and community perspectives in research studies, large-scale data, and AI initiatives. We are honored to be joined by our amazing speakers and panelists, Drs. Greg Kirk, Suzanne Grebe, Tangela Purnell, Joseph Ali, and Reverend Vita Jefferson. And before I give a brief overview on EPI-IDEAS and introduce our guests, I want to mention that this seminar is hosted by the EPI-IDEAS Science Communications Subcommittee, which includes Dr. Carrie Altoff, Amelia Wallace, Laura Camarada, Ann Martin, and Fran Berman. Thank you for all your work in developing this seminar. So for those of you who are less familiar with EPI-IDEAS, it stands for the Epidemiology Department's Inclusion, Diversity, Equity, Anti-Racism, and Science Work Group. EPI-IDEAS works with students, fellows, staff, faculty, and departmental leadership to promote inclusion, diversity, equity, and anti-racism. Two of our core missions are to provide training in communicating epidemiologic science to broad audiences and to promote an epidemiology that engages in public health advocacy. So EPI-IDEAS operates through our subcommittees, and we meet quarterly to share updates and to plan our initiatives. There is a newly formed task force working to understand and improve inclusion of neurodivergent individuals. So students can also learn more and engage with EPI-IDEAS through our ESO meetings. So please email Laura Camarada with your interest and any questions, and please stop by to talk with us after the seminar. To advance our mission, we have hosted a series of seminars since 2017, and these seminars have ranged from topics from discussions on sex, gender, and race as variables and constructs in epidemiologic research to the dissemination of epidemiologic results for public health policy, practice, and advocacy. So today's seminar is sponsored both by EPI-IDEAS and the Bloomberg School of Public Health's newly formed Public Health and AI Strategic Endeavors, or the PHASE Task Force. And the objective of today's seminars are to differentiate types of advisory boards, namely participant advisory boards, community advisory boards, and societal ethical review boards, and to share best practices for building, engaging, and being accountable to the perspectives shared by our board members, and to discuss how best practices need to be modified when such boards advise large data projects and AI initiatives. So we will have 5 distinguished guests joining us today. We have Dr. Gregory Kirk, who is the Vice Dean for Research at the Bloomberg School of Public Health and Professor of Epidemiology and Medicine at Johns Hopkins. Dr. Kirk has tremendous experience working with community advisory boards as the PI of the ALIVE study, and will start our conversation on advisory boards for research studies and large-scale data and AI initiatives. We have Dr. Suzanne Grebe, who's an assistant professor in the Department of Pediatrics at the School of Medicine. Dr. Grebe has expertise in how to build, engage, and incorporate feedback from community advisory boards in research studies, and will present on best practices for doing so. Dr. Tangela Purnell is an associate professor in the Department of Epidemiology. Dr. Purnell's research focuses on health services research for chronic diseases, including chronic kidney disease, diabetes, and hypertension. She serves as the co-lead of the Hopkins Northeast Hub for the AIM Ahead Consortium, a national initiative to improve diversity and equity in artificial intelligence and machine learning, and will offer her expertise on our panel. And Reverend Vita Jefferson, who is an associate minister in the Baltimore community and provides guidance and leadership on Dr. Purnell's research studies, including the AIM Ahead initiative. And we will also have Joseph Ali, who is an associate professor in the Department of International Health at the Bloomberg School of Public Health and an associate director of global programs at the Berman Institute for Bioethics. He will join the panel to speak to the idea of applying ethics and community perspectives onto advisory panels for large-scale data and AI initiatives. And Dr. Amelia Wallace will help guide our session and moderate our panel discussion. So I will invite Dr. Kirk up to present. Thank you.
Good afternoon, everyone. Thanks for the invitation to join you this afternoon. And I want to thank EPI-IDEAS because they've been around for quite some time. The student and the student-driven focus has always been really important to the department and to the school. And I think in many ways, your activities with EPI-IDEAS has informed the larger school's IDEAS initiatives, as well as, the neurodiversity. I hadn't even heard of that yet, but again, taking leadership in many of these areas. I commend the group on all the work that they do. I think I have probably the easiest job today to just sort of describe the framing. There's a lot of difficult, nuanced discussions that I'm sure we will engage in, but I just wanted to sort of, again, I made this slide about an hour ago and sent to Carrie. So I would not call this, very systematic review of the literature, because there's not a lot of literature. I think a lot of this is just sort of trying to put into context some of the ways we think about oversight of research, and that there should be partnerships at multiple different levels. All of our research at the Bloomberg School of Public Health, in some form or fashion, I guess you could say you're working with certain cells, but those cells are linked to another organism that may be linked to a broader ecosystem. But all of our work really is engaged in community and society. And I think that this was just sort of the broad depiction of that. But it's really vital when you think about human subjects research, because what we're doing is we're trying to engage with participants. And in many cases, those participants are a very small section of the broader community in which they live or work or engage. And often we select those participants based on their unique characteristics of their behavior, of where they live, of what they do. And so we're trying to recruit a specific group based on some characteristics. But those participants are engaged and living in a broader community, and then there's the broader societal context. I think that when you think about what are the advisory roles and partnerships that we can envision, in most cases, the way I like to think of this, and again, this is just my framework, we have participants that we recruit into the study, and much of the responsibilities for ensuring that the day-to-day running of that research protocol is appropriate, that there's attention to making sure that results are delivered to an individual participant, that the remuneration is appropriate and not coercive. A lot of that, those responsibilities often lie in the day-to-day aspects with the principal investigator and the research team who are implementing the study. If you think about the partnership with those participants, what we term those are usually participant advisory boards. We used to call them community advisory boards, but they were largely just drawing on people who are already enrolled in the study. And that's not necessarily reflective of the broader community perspective. That's much more what we call it, a participant advisory board. When you then move on towards developing more of a community perspective and who has the ethical responsibility for compliance, as well as in many cases, the sort of institutional requirements for compliance, that then falls to our Human Research Protection Program or our Institutional Review Board, our IRBs. All of the three IRBs around the Hopkins University campus, we all have community members who participate as part of that and weigh in on all of the protocols with a perspective that they bring as community representatives to that process. Many studies, although sometimes these are broader, one community advisory board or CAB may be appropriate for many different studies. There's the ICTR, the Institute for Clinical and Translational Research, has a community engagement core, which often sets up CABs. A lot of acronyms, but PAB is our Participant Advisory Board, CAB is our Community Advisory Board. There's a special type of research, community-based participatory research. I don't have a pointer, that's okay, where you really have integration between the participants in the study and community leaders and or community participants. That it's much more of a dialogue and a longer term thing. I think in some cases that we have different definitions. We have studies that are ongoing within the community. We have community engaged research, and then we have community-based participatory research. And there's a different relative interaction level and feedback. All of these, the IRB now requires in the last 10 years to make sure that studies are disseminating the results of the study back to the community. There was always this, do you give back results of your blood test that you got tested as part of this research study back to the individual participant? But there's also an expectation for a dissemination plan that you actually provide that information back to the broader community from which the participants were drawn. So I think that is what we are used to. What we are not used to is when we think about really large data sets, when we think about AI-driven analyses, when we think about that context, it's really hard to know. In many cases, you don't know if you're a participant or not. Your data may be absorbed from your social media or other source without your really even knowing about it. And then we are left with, what about the societal impact? So the IRB wants to make sure that things are appropriate, that we're not that the risks and benefits are balanced. What about the societal impact? If you develop a tool that has inherent biases and it's applied in a clinical setting and makes the wrong decisions, that's not necessarily something that the IRB will be evaluating up front. So there's obviously societal impacts that are not so easy to predict, and there's not really a clear institutional approach for that. And in many cases, you would query, is that even appropriate for an institutional board or an institutional advisory panel? I'm aware of only Stanford, one institution that has a societal ethical review committee that reviews all protocols that go through. I think this is, maybe Joe, others in the room, we'll get to that in the discussion. There are other sort of things akin to that, but this is actually, if you develop an autonomous vehicle that puts truck drivers out of work, that has societal impact. If you develop research which has societal, it may not do any harm to the individual participants in the study, but the broader impact may have both positive as well as negative ramifications. Who's actually in charge of that? The White House has an AI rule, there's now a blueprint for how we need to have guidance. Is this a government role? Is this a state level role? What's the role of individual institutions in terms of oversight of their own research protocols? I think that is the framing, but we really don't have good answers to that. And I'm pleased that we decided to take this on as a discussion. That's all the introduction and framing that I was going to have. Do someone else want to lead in or just hand it off to Suzanne? Okay, great. Carrying my phone everywhere.
This is not mine.
That was a plug.
Oh. Okay. All right. All right. Well, thank you so much for having me here. I think this is a topic that is of critical importance. It's becoming more and more important in research, and unfortunately, it can be done very poorly, and that can be very damaging. And so it is really important that we take time to really learn how to do this well, and continue actually learning, right? So I'll be talking about building and engaging CABs. All right, so I want to just acknowledge the fact that every CAB is unique. And so while there are some general considerations that we might think about in terms of best practices, there is not a one-size-fits-all model. And that's really, really important to remember. When we are working on building a CAB, on maintaining a CAB, we really have to be mindful of the bigger sociopolitical context. We need to be mindful of our research needs, community advisory board member needs, and the needs of the group, the dynamics of the group. So these are the best practice considerations that I'll talk about a little bit today as we kind of think through how we can best build and engage a CAB. So really important is that the first thing we have to do is really reflect inward. It's really, really important that we are aware of our capabilities and things that may be weaknesses about ourselves as individuals, about our research team, and about our institutions. So things like, have we worked with CABs before? Are we comfortable? Do we have team members that are comfortable in diverse settings, who are open, truly open to listening and to giving up power, right? A lot of us in the academic sphere, we are trained to become the expert, right? And we find our niche and we are the expert. And for some people, it can be very hard to let that go, since we've been kind of pushed along that model for so long. We also have to think about what are our limits, for example, with commitment. Do our timelines allow for this? And that can be personal timelines in terms of your schooling, your promotions, what have you, as well as grant timelines, thinking about institutional policies that may limit what we can do, and so forth. We also want to think about resources that are available. As Dr. Kirk mentioned, there are existing CABs that can help out with projects. And so maybe there's already a CAB in place that you can utilize and leverage rather than building a new CAB. Also thinking about the infrastructure you have in terms of support for administration, the budget, and so forth, and importantly, existing relationships. And then really thinking through where you can be flexible, both at an individual level, a team level, and an institutional level. Where is there flexibility and where are there non-negotiables? And there's always non-negotiables, so that's okay, but we need to be honest about that. And we also really need to be clear. So again, this is all happening before you start to build a CAB. We also need to be very, very clear of why we want a CAB. It's really important that we don't just have a CAB for the sake of having a CAB. It is common nowadays that grants are asking for CABs, and if that is, so that can't be your sole reason, right? Because you can do damage if we're not doing this well. And so we need to have a really clear idea of how a CAB can improve our project and improve the project's impact, right, at a community and or societal level. We need to think about what voices, what skills are missing currently from the project, and think about, how can we, who is it that can come and join a CAB and kind of help fill those gaps. And so that's, is going to lead us to who we, initially recruit for our CABs. Think about the activities we need, and think about, again, now that we have a clear vision of what we, hope to get from the CAB, we have to think about, do we have the capabilities to actually implement that, right? And so again, thinking back of the prior steps of looking inward. And so I like this quote. This is from a project that I was part of that was looking at community engagement within Baltimore's Black sexual minority male communities. And this person said, in terms of engagement generally, and also with formations of CABs, that's the biggest one. It's got to be caring. If it's not genuine, don't do it. And I just really love it because it's coming from someone else, not just me. And I love that we have representation from CAB member here as well. It's not only the academic representatives talking about this issue. And so it also, we really have to think about CAB member most people are probably aware that CAB members need to be compensated. We are paid as part of our work in doing this, and CAB members also need to be adequately paid for their time and their expertise that they're contributing. And often, if someone is coming representing an organization, we might assume that this is part of that work and that they're getting paid through their organization. And so maybe that means we pay, some of money to the organization, but we also have to be aware that sometimes individuals are coming on behalf of an organization, but they're doing it on top of their regular work. And so they still also need to be adequately compensated. We have to think about how to reduce CAB member burden. And there are a lot of ways we can think about this, but importantly, we need to ask. And so we need to talk to folks, like how can we, make it so that it's easy for you to participate? And it's really important here to think about equity versus equality. Some people, if we're trying to include folks with maybe less resources or who are maybe are not people who typically have a seat at the table, they might need more help from us in having them at that table. And so we want to think about, are we providing support in an equitable way? Are we providing it in an equal way? And what are we going to do around that? And I think it's really important also to think about, often CAB members join the work because they're passionate about the topic. It's related to their work, it's related to their lives, it's related to their experiences, and they do it, from that sense of wanting to have impact on something that's very meaningful to them. But there's often other motivations as well, and it's important to think about the ways that the relationship is not solely a give and take, but more reciprocal. So what are ways that we can incorporate some of the things that they hope to get out of this experience, which may, require additional work on our end to make sure that that happens. But again, very important to think about. So we often, when we start, we have now our idea of who we want to be part of the CAB, and we might start going out to the community and speaking to people, talking about the CAB, leveraging our networks or colleagues' networks and so forth. And we might have an idea about the processes that we are expecting, right? We might know that we're planning on meeting once a month for 2 hours, and we're going to do A, B, and C. But it's really, we have to be open to revising those processes once the members are engaged. Because as we think about the group dynamics, that might change some things, right? We might think that, okay, we're just going to do this by consensus. And then as a group realize, oh, that's not quite working, and we'd rather have a different way of making decisions. And so these are things that need to be talked about. We have to spend time thinking through these things at the beginning, but then also periodically as well. Often CABs start small and then kind of grow a bit, and we need to continually reflect on this and revise as needed. And I have a line here around being mindful of power dynamics. Often our CABs may have representatives from various kind of subgroups, right? We might have folks who are service providers, we might have folks that are there due to lived experience, and so forth. And the power dynamics and inequalities that exist out in the world can very easily be brought into the space of the CAB. And what we don't want is that just to be recreated, which can happen if, very easily if we're not being mindful to it. And so just as an example, this is a real life example from a colleague of mine who was working around syringe service programs. And on the CAB, they had healthcare providers, people who work at the syringe service program, and they had people who use drugs. And at some point, a couple of the individuals who represented the clients of the syringe service programs came and talked to her about feeling like they had no impact, like they weren't sure why they were there. And it was the fact that people kind of unintentionally were kind of gearing everything to the healthcare providers because they were the experts in service delivery. They understood the kind of health impacts of injection drug use. And And that wasn't something that was necessarily intentional on anyone's part, but it was just that recreation of whose voice counts in society that was happening back in the cab, and that needed to be adjusted. So we really have to be mindful of power dynamics and making sure that we're not recreating these. And with that, we have to think about communication and transparency. Transparency is really critical in building trust. And it's really about providing an opportunity, an environment where communication is clear, it is understood, and it is transparent. And so, this is things such as being very clear and transparent about what we can and cannot do, what we are hoping CAB members can bring to the table, and so forth. And really importantly, it's being transparent in how we use their information. So if CAB members provide us feedback, we ultimately, if this is not CBPR context, but more community engaged, we ultimately, someone from the research team or multiple people from the research team ultimately takes that information and decides whether or not to implement change in response. And so we need to really be clear on what information we used and how it impacted or changed the work. And if we don't make changes based on that impact, we need to also be very clear in that decision-making process of why then that wasn't incorporated. And so again, that really helps build trust, allows people to see that their input is valued and is taken seriously, and can make them understand that this really is a meaningful experience, if you will. So another issue that we want to be aware of is unintentional disempowerment. And we can't always predict where this might show up, but we can think about some situations in which it might. And so in thinking about large-scale data or AI, this might be things that CAB members are just less confident about in their ability to contribute, right? Maybe AI is very new. A lot of people don't know a lot about it, for example. And so there might be some concerns of like, I don't really know what I can add to this. And so we have to be, thoughtful in how we talk about it, how we, maybe provide trainings or provide opportunities to learn. We might have to think about creative ways to elicit CAB feedback that might be less intimidating. And importantly, if we talk about AI, while we might be approaching AI as having the potential to have really amazing impacts on health disparities, there is also real concern that maybe it's going to create bigger health disparities, right? There might be societal impacts that are unanticipated, and so there might be some mistrust of AI, and we have to have those conversations, right? We don't want to steer away from those conversations, but rather embrace them, listen, respect them, and make sure that people don't just become silent when those types of issues in the research come up. And then another one is around technical stages of research. And just as examples, sometimes the ethics review, the IRB review can take a really long time. Sometimes the data analysis can take a really long time. And so during these periods, if there's not adequate planning and thought given to what CAB members will be doing, then they can again feel like their contributions are not valued and kind of become less engaged. Or if there's a big time gap in engagement, they can kind of fall off and get involved in other things and not then continue to feel part of the project. And so, we want to be very clear on those, when those things are going to happen in the timelines, and if possible, create activities to do in that time that are also very meaningful. So, you can already start building a lot of the dissemination planning even before you have the findings, and actually should, develop dissemination plans pretty early in the work actually, but this is a great time to think about dissemination opportunities. Or if there are activities that the CAB is really interested in pursuing that isn't necessarily part of the research, this might be an opportunity to kind of explore those things. But we want to be, thoughtful of those times and make sure that our CAB members still feel that they are contributing in a meaningful way and that they are still valued. I don't want to spend too much time on this one other than to say we want to make sure we're celebrating successes, we're celebrating the input and the impact of our CAB members, both at the professional level, then of course just at the basic human level, right? Like we celebrate our colleagues' birthdays, we want to celebrate with the CAB members as well, and really recognize the importance of their presence. And then we want to also just continue this practice of ongoing reflection. And so again, this is at the individual level, the research team level. You know, are we doing what we can? Can we identify areas we can improve? And I will say 9 times out of 10, that's yes, right? We can find places that we can further our ability to work in a meaningful and respectful way with CAB members and doing this work. And also think about the team members that are working directly with the CAB. Are these the right people? Is the CAB environment one that is constructive and at least from our perspective as the research team, one that is successful? And then again, thinking about, are the activities contributing to the research as possible or as intended, excuse me, and are the CAB inputs valued or implemented to the extent possible? And if you find yourself saying no, then again, we have to like kind of step back and just say, okay, is the CAB just a token? Are they just there symbolically? Or is this really a CAB that we have established to impact the work? And if it's not impacting the work, then we need to think about that long and hard about whether or not we continue, because we should not just have symbolic representation. And then we also want to be evaluating the CAB, making sure that CAB members have a voice in telling us how the process is going for them. So there's many ways in which we can do this. Two very common ways are just through anonymous surveys. There are established ones that can be used, or doing interviews with CAB members, someone from outside the team, not a research team member or someone involved with the CAB, but an external person. And the results of that then are discussed, right? So you might think that the CAB is going really well, but then the evaluations show that some members feel like there are power dynamics that are not just, or they don't feel like they're being heard. And it provides a platform then to have those open conversations and really see how, as a group, things can be changed so that people do feel valued, they do feel heard, and the CAB can be a success in all respects. So just as some closing points, I really want to reiterate that healthy, sustainable, and productive CABs take a lot of time and a lot of investment. They should be adequately resourced. They shouldn't be thrown on last minute because you think it might help or it might look good. They really need to be well prepared for to be able to do it well. And that is really, as I've already mentioned, because if poor community engagement can be harmful to communities and can further perpetuate mistrust in research and medicine. And so, part of the push to do more community engagement is try to reduce mistrust, try to improve translation of the science, and try to improve, health outcomes. But there is a possibility that we are actually causing harm if we don't do it well. And I think that sometimes gets overlooked. And then we need to, again, be honest with ourselves about what we can and cannot do, make sure that we're doing it for the right reasons, and that we are engaging folks in a way that is meaningful to everyone. And then this is, a whole other area, but I at least want to just make the point here that when we are disseminating our findings in the academic lens, particularly, although in general this is true, but in the academic sense, we are so limited by word counts that often we don't say much about the CABs. We might say we had a CAB, but it really is important that we do have transparency here in terms of the role of the CAB members, what they had influence on, and what maybe they did not. This is important to acknowledge their contributions to the work, but again, it's also a way to ensure, hopefully, or maybe reduce the impact, maybe insurer's too strong, but reduce the likelihood that a cab is just a token, right? If we have to explain to people, it allows the reader to assess whether or not the cab really was a influence or whether it was a symbolic gesture. So thank you all again for your interest in this topic, and yeah, I look forward to learning more from my colleagues on the panel and you all. So, yep.
Two routes.
Yes, we have multiple routes. You can go the other direction, whatever you decide. Okay, so thank you all so much for joining us. Yep. Stop share. Okay, great. And we will start opening that when we have questions. Okay, thank you guys all so much for joining us. I'm going to start off with a few questions, and then we're going to open it up to the audience. And we have people monitoring on Zoom as well, so we can check for Zoom questions. So first, I want to direct this to Reverend Jefferson. Sorry, reading through my questions. So I just want to get your perspective, so your reflection on your role that you've had in participating in community advisory boards, and why you chose to do so and why you continue to do so, because I know that Tangela has engaged you in a number of activities.
Absolutely. First of all, I'd like to say thank you for the invitation to be here. And then secondly, because of the concerns within various communities perhaps that have been felt underrepresented, regardless of the research, be it healthcare or technology, et cetera. And so I've been privileged to have the opportunity to serve and be a voice within various communities and on various community advisory boards in the area. And I do continue to do it because I feel that it is a calling. It is a calling for me to be able to serve as a conduit, to serve as a bridge, if you will, with participants as well as the community at large, with different academics, different research projects that are going on. And I will also add that it has been not only rewarding for me, but to see the impact that intentional, focused community advisory are quite beneficial to the outcome. Thank you.
Thank you so much for that. And then maybe we could have a question for Mr. Ali. So Joseph Ali, he works with the Berman Institute and thinks a lot about ethical issues. So do you have any specific reflections on how these large-scale data and AI initiatives are going to be incorporating, or how best to think about incorporating community's voice into these initiatives?
Great. Yeah, thanks. Thanks for the invitation and thanks for the question. So I think there are a lot of different models. I think many were described, and we emphasized the role of CABs in research and in AI and data-intensive settings, but there are other models and approaches that can be used. Greg mentioned, the role of external oversight, of sort of expertise and that sort of thing, and that can play a role. But in addition to CABs, there are also examples from other areas of digital health that might be adopted. For example, communities of users of the technology developing norms and standards and expectations around how the technology ought to be used, which is very common when we saw social media coming into the space of public health. A way of thinking about a form of governance. More broadly in technology development spaces, sometimes there are people who push for market mechanisms to influence practice, and that's another area to examine, I think, closely. There are strong opinions on the use of that process, that mechanism for governance, but there are ways in which some users of technology and developers of technology have tried to create open access fora and mechanisms for for data sharing and increasing the relevance of technology for communities through creating, through market mechanisms, making things freely available and accessible, making open source code and those kinds of things. So there's that function. But it's a complicated space because the financing is always tricky, right? There's a lot of data that's being used and integrated into AI technologies that may have certain intellectual property rights attached to it, may have sort of cultural rights attached to it, and other kinds of interests. And that's a somewhat scary thing, you know, when this absorption of information across a number of different spheres, ideally for the benefit of society, right? So there's a transaction that's happening implicitly here where we have useful information that's going into systems to produce outputs that ideally would be beneficial to populations, but there are always questions about accessibility and equity that come along with that, about who has access to those outputs, and is it reflective of the inputs, the value that's going in, is it going out to the people who maybe it should go to? So, yeah.
And do they have the ability to access or utilize it themselves?
Yes, exactly, yeah.
So maybe that's a good additional question to Dr. Kirk. So I know that you're involved in developing a lot of the protocols and research for the universe or for the school as a whole. Yes, as the vice chair of research. So how are you thinking about trying to encourage people to develop community advisory boards and take community input without running into the issue of tokenization, like Suzanne talked about, of like people by requiring things, you may cause people to not think through it fully?
Sure. So it's not easy to really do that well. And I think Suzanne's major point was, if you're going to do it, you need to do it well. And if, like, we have many excellent scientists and researchers and great teams doing lots of work, but many aren't really adept at community engagement interaction. Many aren't dissemination scientists, how to present the results in a non-academic format. Yet sometimes we say you need to do this and you need to have a dissemination plan. And I think in some cases, we probably are asking too much of people whose training and background aren't really appropriate for that. So I think we need to leverage, though, I sort of alluded to, and Suzanne mentioned, there are some community advisory boards that are broader. And if you are an investigator, a student project, should all students be expected to go through and try to scramble around and find their funding and develop their own CAB? That's not a realistic expectation. But we have some broader community advisory panels, particularly for studies in Baltimore. Outside of Baltimore, now you're talking even greater degree of difficulty. But I think that we can leverage some of our existing community, when I say community, I like Hopkins community level resources. I hear, the other difficulty, though, is that we often tend to ask the same individuals to be on multiple CABs. We ask for those researchers with expertise in the field to be engaged in many other different things. So it's a balance of, we can't then go and always ask the same people to do, to check that box and to provide their input. So it's a difficult balance. I think there's a role for the school to play to facilitate these things. And as part of that investment, Dr. Vanya Jones is who I had suggested to be on the panel. She's our new assistant dean for community engaged research. And she just started, it's a brand new position. And at the school level, I think we recognize that we need to at least have best practices and information readily available to investigators and teams. Secondly, provide some supports and trainings as needed, and to support those broader school level functions.
Dr. Jones does send her regrets for not being able to be with us today. We have a question on Zoom.
Hi, everyone. This question is for the panelists. It says, are there specific aspects of AI and machine learning that call for a special need of a CAB as opposed to, for example, human subject studies or mathematical research on the other end?
So I'm happy to take a first stab at that. So as part of my role as the co-lead for the Northeast Hub of the Aim Ahead initiative, I think the NIH, with an initial investment of about $50 million in the first 2 years, recognized that many of the tools that are typically developed within the data science field more broadly, AI, machine learning included within that, are often, developed by teams who have very little interaction with the ultimate end users or the target populations. And sometimes what we find is that either the relevance of those tools don't necessarily match the reality of what happens when it goes into the market or into the field. Or we find, for example, if we collectively go back to 2020, and those of us who are perhaps darker than a sheet of paper or a brown paper bag would disappear, right, on Zoom if we use the virtual background. So we recognize that our tools and our algorithms are only as good as the quality of the data and the quality of the input that goes into them. And this is a long-standing issue, really, as a person who initially trained as a computer scientist, I sort of know like this has always been an issue. It's really cool to develop new technology, new tools, and we're all excited about it. But often we don't necessarily take the time to make sure that other people who are outside of our fields are also excited about it, or that they actually work in the way that we anticipated for multiple audiences. And so part of what we're doing now is really emphasizing that community engagement and actually the engagement of the end users and participants have to start at the very beginning, regardless of whether it's that we're developing new equations that we believe will then inform clinical practice, to we're developing algorithms that we then believe will be used to automate certain tasks, et cetera. We have to really engage people who, again, we hope that this work will impact, but also because of these issues around fear and distrust, right? We have to also engage people who are already trusted agents. We have to have people who already have relationships within communities who may be less inclined to want to work with us on our cool, novel, new studies. And often, the first thing that people will ask is, well, who do I know who was a part of that team, right? Or who can vouch for you and vouch that you're not here just to take from us and to go and use our data or use our specimens in nefarious ways. And so because all of that plays a role in ultimately how effective and how relevant and also the uptake of the end results, I think it really speaks to why this has to be something that we integrate at multiple stages of the process, regardless of the specific research question.
I think I would, was there another question? I was just going to echo those comments. Needs to start early. It needs to flow through the process. The specific question from Zoom was about what's really different about this. I think the point is there's not, all types of research should have this. I think the difficulty is that we're at the earlier stages of how to know how to implement guidance. There largely isn't federal guidance for many of these things. And the other complicating issue specific to these is, okay, I was saying like maybe not everyone in our school is so adept at that, but they're in a school of public health and they, they need to recognize what they don't know. I think that the concern is that as you move towards data science, no offense to computer scientists, our engineering colleagues, as we move farther and farther away from a public health faculty and research teams, the concern is these issues will be less and less recognized, particularly early on. And there's the expectation that, well, here's my algorithm and it's going to solve the problem. And I think that we need to interrupt that expectation earlier on.
Yeah, maybe you have some thoughts on this, but I know that this has been kind of a frustration from the epidemiology department, is that this new AI initiative has been started by the university, started by the school. It's run through the School of Engineering, who are, again, those people that may not have kind of the expertise in public health and like thinking about human subjects. How are people in leadership of the university thinking about trying to incorporate the existing experience that does exist here in the School of Public Health, not just the school, not just the Department of Epidemiology, but throughout the school, and trying to incorporate that more into those initiatives?
Sure, great questions. Very huge investments for data science and AI. And you're right, most of that has landed in engineering's lap. And there's a lot of concern, appropriately, that our data science and broader expertise in health and public health isn't been valued. And just like we advocate for public health and we advocate for our issues in broader settings, we have to do the same here in the university setting. And I do think that, it takes repetition, it takes a clear articulation of what the issues are and what the value that our school brings in this area. And part of it is why we also launched the phase. Another plug for phase. We'll put the slide back up there, but this is really to solidify our community together in recognizing that we do have that expertise. I think there's been this hesitation that I don't have an engineering degree. I didn't train in computer science, and maybe I'm not valued to say that I'm really worthy of resources or really at the table, at the data science table. So I think that that's part of it. And to then just develop better strategies for how we advocate and have a broader role, not just in the university, but we'd like to be public health and AI focus more broadly, including globally.
And I think to follow up on that, it's fascinating to me that you all were so generous with your time and said yes when we requested that you join us to talk about this topic and to push it forward. So kind of as the people who oftentimes are the collectors of the data or the curators of the data, who know our study populations, who engage with them, and who are always pushing towards more involvement, right? And looking to our colleagues who have done such a good job of involving participants and community. How do we take what we're doing now and, number one, make sure that our colleagues across the board, as new studies come and go, are incorporating these best principles, maybe not establishing a participant or community advisory board for every study that gets funded so that we're not tapping out people again and again and again. But then also, how do we ensure that this is done right? Because, Suzanne, I really appreciate, having worked with you in the past, that you will tell us when we're not doing it right, but not everybody can have you. There aren't that many minutes in the day. So how do we kind of continue to move forward, pushing forth these, highest standards for how we engage communities, and hopefully, Dr. Jones will be a part of this conversation in the broader school level, but just, Tangela and Suzanne and Joe and Greg and Reverend Jefferson, how do we do this in just little steps? Break it down for me.
Okay, I'm happy to get us started. I think that the first thing is that we have to, the universal we have to do a better job of recognizing even the efforts that those of us who do this work, sort of do behind the scenes, right? Often the things that get us promoted are the papers, are the grants, are the teaching, but all of the work that it takes into building trust, especially within communities that historically have not had a great relationship with our university, often goes uncompensated, often goes, sort of overlooked. So I think that thinking about ways to actually, officially acknowledge the efforts that really go into developing those relationships will probably be, a great first step. In addition to, of course, more resources, because again, often that's not something, thankfully now, there are some funders like PCORI, like certain institutes within the NIH that are providing some funds for that initial relationship building process, but many of them kind of already anticipate that you will have those working relationships, that you will already have established partners. And so again, thinking about, additional internal funds through the university that will help to do that. I think that we do have courses here across the school that often teach best practices for building community partnerships, for conducting community-based participatory research. I think that those are certainly resources, even if you're just auditing the course, to sort of listen to the lectures at the more junior level. And also, when I was getting started in this, the best teacher for me was actually attending study team meetings with my mentors, right, who were kind of doing the work. Before I ever really tried to engage community members on my own, I had spent years sort of just attending CAB meetings and attending study team meetings and watching the dynamic and the what does it take and how should you respond when the CAB member doesn't think that your idea is so great, right? When they're giving you real feedback, or when they're giving you legitimate feedback, but you really just do not have the resources or the time to feasibly incorporate that. How do you, communicate that back? Because that's also important, to acknowledge when people give recommendations and even acknowledge the limitations of the current work. So I just kind of, spent years as a student kind of in the shadows, sort of watching. And over time, it also helped me to get involved in other ways. So for example, trying to partner with existing community organizations. There are often volunteer efforts and days, for example, in partnership with Source and other groups. Often just getting to know what's important, what are the priorities, and then even thinking about the dynamics of how we sort of interact with each other. Those are things that could kind of happen in more informal ways before the more formal piece ever gets started.
Just a quick addition on I think Tangela's very, very insightful comments on this topic. I think also thinking of Greg's initial diagram, as simple as it was, I thought it was helpful. And there's an important role.
It was not AI generated.
I'm glad you're not a robot. There's an important role obviously for the community engagement piece, but also at the furthest out level, the societal level that Greg was mentioning, right? There's public engagement, right? And that is important, and something we can do as well within the school is to refine the methodology and to apply it to the use of AI in various contexts and public health contexts, and engage with people in deliberative sessions about this use and try to elicit more perspectives and understanding, both about the process, but also about the substance of.
I would just briefly like to say that in addition to this very large data science investment, another major university priority is better engagement with Baltimore. And I think that the community societal, input that Joe alludes to, I think we should frame a request for resources to merge those two, and that many of the people here at this table should probably be, at the Data Science AI Institute discussions about how to engage. I think that I think is very Baltimore focused, recognizing that we have such a large global portfolio, and Joe actually is very engaged in that. We need to think about how we would expand that to a broader global perspective, but perhaps that's beyond today.
And just from a community engagement perspective and listening to some of the question about the concern and using the same people over and over, when you are intentional, as Susanna said earlier, and focused on establishing a community advisory board, then you're going to build that trust, transparency, and that's how you can multiply the group. You'll have a key person, maybe leaders, that will begin and introduce the researchers, networking, but you're going to have to show up. You're going to have to be present. You're going to have to be visible. You're going to have to understand the priorities within those communities. And that key word, transparency and trustworthiness, you'll build that and you'll be able to increase and invite others to participate and grow your network of community advisory boards.
Just mentioning around the training, so just to everyone listening, I teach the community-based participatory research here in the School of Public Health in second term, and I often get faculty and students who are interested in auditing or just want the materials, and I am always happy to share materials. It's not the same as taking the course, but it hopefully can be just an opening, right, to learning a little bit more. So I'm always happy to share any of those resources that, you know, if you took the class, you would get.
We have one more Zoom question.
Thank you all very much. This is a question for Reverend Jefferson, and this was continuing on the question of AI. As a non-academic leader, what aspects of data and AI are most concerning to you?
Wow, fortunately for Vita, I had an opportunity to be introduced to AI, you know, a while ago back. But I think it goes back to being transparent, communicating, and educating those within the community. You're going to have to be careful not to introduce it with your academic jargon, no disrespect to all of my academics, but no acronyms, you know, just make it plain, meet them where they are, make it plain. And I appreciate Suzanne saying, be welcome to the feedback, be welcome for questions. And we have to remove or tilt it to the side, if you will, our academic hat, because your community may not recognize some of those terminologies. Just hearing AI could be intimidating. And so it goes back again to just being transparent, being clear, and educating, and welcoming those questions that they are going to have.
I think that as we think about, from my own personal experience, we have a study that's been going on for 35 years. The AIDS linked to the intravenous experience engages with persons from Baltimore City. We've now expounded to a little bit to Baltimore County, but it engages with people with a history of using drugs. We have some individual participants who've come to their 6-month visit 70 times. So that's a long time. We have Eileen, who runs our participant advisory board, was on the call. We have staff who've been there for 2 decades. So there's a long history and a lot of engagement. And I think that it's hard to come in, and I would struggle to explain black box algorithms and what are the implications of that. I think what we have to struggle with is the big brother aspects of some of the AI measurement. And I think particularly for epidemiologists, that's a really important thing. We've done studies where we can monitor where you go using your smartphone. Now we can put a little device in and listen and figure out what's going on inside your house. Like, I think discussions about how to balance the intrusiveness of some of our measurement approaches with appropriate safeguards for privacy and or who gets to see the data, I think that's what we as a community need to develop a better handle on.
If I may, I just wanted to follow up on Greg's point about the intrusiveness or the fear around the intrusiveness. And, you know, that was often the very first question that I got, even from some longstanding sort of community partners on other studies. So kidney wasn't scary. Heart disease wasn't scary. Diabetes was not scary. But AI was, oh, wait a minute. Do you mean the thing where, you know, technology and robots are going to take over and, you know, are they tracking us? And, you know, what does this mean? I'm not quite sure. And, you know, when people, again, when we sort of put down some of our acronyms, some of our own ways of how we understand these things to be connected, and try to reframe it within the context of what people already feel comfortable doing, then often, you know, we get the, you mean what happens when, you know, I mentioned the word shopping, and all of a sudden I start to get a bunch of ads for the closest mall is da-da-da-da-da, or when my car stops in East Baltimore and all of a sudden I get a pop-up from Google Maps saying, I think that you're close to Johns Hopkins University. Would you like me to pull up the schedule for, you know, so, or, you know, Amazon Alexa. So all of these are things sometimes that people are already engaging with to some degree, but they don't necessarily refer to it as AI or, machine learning, et cetera. So I think being well versed in how to really translate what we're saying in ways that resonate with others in the community also kind of helps with some of those fears.
We're at time, so you can have our last response, but then we'll wrap it up. So feel free, yeah.
It's not a summative kind of, I'll let others do the summary. But I just think, I mean, it's complicated. There's a lot of literature and there's empirical research on like privacy paradoxes and things like that, where people's stated preferences kind of diverge from their behaviors, and that's an interesting phenomenon to be looking at. But there's another area of interest that that relates to these kind of regular everyday examples of how we use technology and what we're willing to accept or not accept. And for the most part, people are willing to accept certain things if they see a return of some form of benefit or value to themselves. And that's always a challenge, I think, in epidemiology and in science in general, is that communicating that transfer of value is a hard thing to do, and it often is distant and remote. So we need to do a better job at communicating about the value exchange, the value proposition as well, in a truthful way, of course, and with transparency and all of that. But also think creatively about how do we enhance that benefit sharing interaction, potentially through the use of technology even, so that people do derive some value from their engagement.
Well, thank you guys all for your participation and for sort of muddling through this topic with us, because I know that this is something that we're all interested in learning about, but I think nobody really has a great handle on it. So thank you guys for helping us with that conversation. So yes, thank you very much.